Sit quietly for a moment. And think about this one simple question. How do you actually know if your period is normal? Most women never ask this. And most of the time, they assume whatever they experience is just how my body is. But here is the truth. A very large number of women are living with symptoms they believe are normal, when in reality, they are not. And today, we are going to decode that confusion. Slowly. Clearly. Without fear. Without myths. Let's start with something basic. A menstrual cycle is not just a monthly event. It is a reflection of your hormonal health. On average, a normal menstrual cycle can range from 21 days to 35 days. Not just 28 days. This is very important because many women panic when their cycle is not exactly 28 days. But biology is not a fixed calendar. Your body is not a machine. So the first myth we are breaking today is simple. A perfect 28-day cycle is not required for good health. There is a range. And your body can still be completely normal within that range. Now let's talk about duration. How long should bleeding last? A normal period usually lasts between 2 to 7 days. Less than 2 days or more than 7 days regularly can be a sign that your hormones need attention. But again, one single cycle does not define a problem. What matters is consistency over time. Now let's move to something many women silently worry about. Pain. Mild cramps during periods are common. In fact, many women experience discomfort in the lower abdomen or back. But here is the important distinction. Mild discomfort that allows you to continue your daily routine is generally considered normal. However, if your pain is so severe that you cannot stand properly, you miss work or school, or you are dependent on strong painkillers every month, then this is not something you should ignore. Because severe menstrual pain can sometimes be linked to underlying conditions that need proper medical evaluation. Now let's talk about flow. This is something many women misunderstand. A normal flow is usually moderate. You may need to change pads every 3 to 6 hours depending on your body. But if you are experiencing very heavy bleeding, where you need to change your pad every hour, this is not something to overlook. Heavy bleeding repeatedly can lead to fatigue, weakness, and iron deficiency over time. And most importantly, it is your body sending a signal. Now let's address something even more confusing for women. Blood clots. Many women panic when they see small clots during periods. But here is the truth. Small clots can sometimes be normal during menstruation. However, if you are noticing large clots frequently, or clots along with very heavy bleeding, then it should not be ignored. Because again, your cycle is communicating something about your internal balance. Now I want to talk about something very important. Skipping periods. Many young women think, I missed my period, maybe it's normal. Sometimes it can happen due to stress, travel, or lifestyle changes. But if your periods are frequently irregular, or you skip cycles often, then it may be a sign of hormonal imbalance. One of the common conditions linked with this is PCOS, polycystic ovary syndrome. And many women live with it without even knowing. Now pause for a second. Because what I am telling you is not to create fear. It is to create awareness. Your period is not just a monthly inconvenience. It is a vital sign of your health, just like blood pressure or heart rate. And ignoring it for years can delay diagnosis of conditions that are easily manageable when caught early. But here is something equally important. Not every variation means disease. Your body changes with stress, diet, sleep, travel, age, and lifestyle. So the goal is not perfection. The goal is awareness. Let me summarize what we covered so far. A normal cycle is usually 21 to 35 days. Bleeding typically lasts 2 to 7 days. Mild cramps can be normal. But severe pain is not something to ignore. Moderate flow is expected. Very heavy bleeding needs attention. Occasional irregularity can happen. But frequent irregular cycles may indicate hormonal imbalance. And now, I want you to reflect on something. How many times have you ignored your symptoms? Just because someone told you it's normal for women? How many times did you suffer quietly, thinking it is something you just have to live with? Because that is where the real problem begins. Not in the symptom itself, but in the silence around it. In the next part, we will go deeper. We will talk about what your period color means, why hormonal imbalance happens, early warning signs of PCOS, and what your body is trying to tell you before problems become serious. Because understanding your body is not about fear. It is about clarity. After understanding what is considered a normal cycle, now we go a step deeper. Because here is something most women are never told clearly. Your period is not just bleeding. It is a monthly report card of your internal hormonal system. And if you learn how to read it, you can understand your body far better than most people ever do. Let's start with something very important. The color of your menstrual blood. Yes, color matters. Many women notice changes but ignore them. So let's decode it simply. Bright red blood usually indicates fresh flow. It is commonly seen at the beginning of the cycle. This is generally normal. But if your flow stays excessively bright red and very heavy for many days, it may indicate a strong uterine lining shedding or hormonal imbalance. Now let's talk about darker red or brownish blood. This is very common at the beginning or end of a period. Brown color usually means older blood that is leaving the body slowly. In most cases, this is normal. But again, context matters. Now here is where attention becomes important. Very dark, almost blackish blood that appears consistently and is associated with pain or irregular cycles may indicate that the blood is staying in the uterus longer than it should. This does not automatically mean disease, but it is a signal worth noticing. Now let's move to something even more important. Why do hormonal imbalances happen? Because this is at the root of most menstrual problems. Your hormones are influenced by many things. Stress levels, sleep quality, diet, body weight changes, physical activity, and even emotional health. Your reproductive system is not isolated. It reacts to your entire lifestyle. Let's take an example. A woman under constant stress may experience delayed or missed periods. Why? Because stress affects the brain signals that control hormone release. So your body shifts into survival mode instead of reproductive balance. Now let's talk about one of the most common conditions in women today. PCOS, polycystic ovary syndrome. Many women hear this term but do not fully understand it. So let's simplify it. PCOS is not just about cysts. It is a hormonal imbalance condition that affects ovulation and menstrual regularity. Common early signs include irregular periods, acne that persists beyond teenage years, unwanted facial or body hair growth, weight gain around the abdomen, or difficulty in losing weight. But here is the important point. Not every symptom must be present. Sometimes even 2 or 3 signs together can indicate PCOS. Now I want you to understand something very carefully. PCOS is not rare anymore. Due to modern lifestyle changes, stress, diet, and reduced physical activity, it has become increasingly common. But the good news is, early detection makes management much easier. Now let's talk about something many women silently struggle with. White or vaginal discharge. This is one of the most misunderstood topics. So let's clear it. Normal discharge is usually clear or milky white, mild in smell or odorless. and varies during the cycle. It actually helps protect the reproductive system. So yes, normal discharge is healthy. But there are warning signs. If discharge becomes yellow, green, or gray. If there is strong foul smell. If it is associated with itching or burning. Then this is not normal and should be evaluated. Now let's pause for a moment. Because I want you to notice something important. Most women suffer in silence. Not because their symptoms are severe, but because they were never taught what is normal. And that silence leads to delay. Delay in understanding. Delay in diagnosis. Delay in treatment. But your body always communicates early. You just need to learn its language. Let's go back to your cycle again. If your periods suddenly become irregular after being normal for years, don't ignore it. If your flow suddenly becomes too heavy or too light, don't ignore it. If your pain level suddenly increases significantly, don't ignore it. Because your menstrual cycle is not random. It reflects your hormone balance, your reproductive health, and your overall well-being. Now here is something very important to understand. One irregular cycle is not a diagnosis. But repeated patterns are. That is why tracking your cycle is so important. Even simple mobile apps can help you identify patterns over time. Now I want you to reflect again. How often have you normalized discomfort? How often have you said, "It's okay, it happens to everyone." But not everything common is healthy. And not everything silent is safe. In the next part, we will go deeper into what causes missed periods, early fertility signals, stress and hormone connection, and when you should actually see a doctor. Because understanding your body is not about fear. It is about awareness and control. Now let's talk about something that creates a lot of confusion for women. Missed periods. Because when a period is late, most women immediately start worrying. And sometimes that worry turns into fear. But let's understand this clearly and calmly. A missed period does not always mean something serious. Your menstrual cycle is sensitive. It responds to your body like a mirror. So even small changes in your lifestyle can temporarily delay it. For example, high stress levels, poor sleep for several days, sudden weight loss or weight gain, intense physical activity, travel or time zone changes. All of these can affect your cycle. Your brain controls hormone release. And when your body feels under pressure, it may delay ovulation. And when ovulation is delayed, your period is delayed too. But now here is the important part. Occasional delay is common. But frequent irregularity is not something to ignore. If your periods are repeatedly late or absent, it is your body signaling hormonal imbalance. Now let's talk about something very important for long-term health. Fertility signals. Your menstrual cycle is closely connected to fertility. But fertility is not just about getting pregnant. It is about whether your body is ovulating regularly. Ovulation is the release of an egg from the ovary. If ovulation is happening regularly, your cycle is generally healthy. But if ovulation becomes irregular or absent, your cycle will show it. Now here are some subtle signs of ovulation issues. Very irregular periods. Long gaps between cycles. Very light or very heavy unpredictable bleeding. Or absence of periods for months. And one important condition linked to this is PCOS. As we discussed earlier, PCOS affects ovulation, which means the body may not release an egg regularly. This directly impacts menstrual regularity. But again, I want to make this very clear. Having symptoms does not automatically mean a diagnosis. It means your body may need evaluation. Now let's talk about something most women overlook. Stress. Chronic stress is one of the biggest hidden disruptors of menstrual health. When you are stressed for long periods, Your body increases cortisol levels. Cortisol is a stress hormone. And when cortisol stays high, it interferes with reproductive hormones. This can lead to delayed periods, missed cycles, changes in flow, or even temporary absence of menstruation. So sometimes the issue is not disease. Sometimes it is lifestyle pressure. And your body is simply responding to it. Now let's talk about another important warning sign. Sudden changes in your cycle. If your periods have always been regular and suddenly become irregular, this should not be ignored, especially if it continues for several months, because persistent changes can sometimes indicate thyroid imbalance, hormonal disorders, or reproductive system issues. Now let's discuss pain again briefly, because this is where many women normalize suffering. If period pain increases over time, or becomes significantly worse suddenly, this is not something to ignore. Severe pain may sometimes be linked to conditions like endometriosis, fibroids, or other uterine issues. These are treatable conditions. But early detection makes a huge difference. Now I want you to understand something very important. Your period should not control your life. You should be able to function normally. Yes, mild discomfort is common. But extreme disruption is not something you should accept as normal. Now let's pause for a moment, because I want to shift your thinking. Most women only react when something becomes severe. But health awareness is about noticing early signals. Your body rarely speaks loudly at first. It starts with small signs. A delay. A change in flow. A slight increase in pain. A shift in cycle timing. These are early messages. And if ignored repeatedly, they can become bigger issues later. Now let's summarize what we learned in this part. Missed periods are often linked to stress or lifestyle changes. But frequent irregularity needs attention. Ovulation is key to a healthy cycle. Stress can directly affect hormones. Sudden changes in cycles should not be ignored. And persistent pain may indicate underlying conditions. Now ask yourself honestly. Have you ever tracked your cycle properly? Or have you just noticed it when it arrives, or doesn't? Because awareness begins with observation. In the next part, we will go deeper into when to actually see a doctor, danger signs women should never ignore, common myths about periods, and how to take control of your reproductive health. This is where everything becomes practical and empowering. Now we come to one of the most important parts of understanding your menstrual health. When should you actually see a doctor? Because many women either wait too long or worry unnecessarily. So let's make this simple and clear. First, let's talk about red flags. These are signs your body should not be ignored. If you experience very heavy bleeding repeatedly, where you are changing pads every hour or two, this is not normal. It may lead to weakness, fatigue, and low iron levels over time. If your periods last longer than 7 days consistently, that is also something that needs evaluation. One long cycle occasionally is not a problem, but a repeated pattern is. Now let's talk about pain. Severe period pain that stops you from doing daily activities, requires strong painkillers every month, or gets worse over time, is not something to ignore. Pain is your body's signal. Mild discomfort can be normal. But disabling pain is not something you should accept as just part of being a woman. Now another important red flag. If your periods suddenly stop for 2 to 3 months or more, without pregnancy or obvious reason, you should get checked. Because your body is always trying to communicate something. Now let's address something very common. Irregular cycles. If your periods are sometimes early, sometimes late, and unpredictable for several months, this suggests hormonal imbalance. And it should not be ignored if it continues. Now let's move to myths. Because misinformation is one of the biggest problems in women's health. Myth number 1. Severe pain during periods is normal for every woman. False. While mild cramps are common, severe pain that affects your life is not something you should ignore. Myth number 2. Missing a period always means pregnancy. False. There are many reasons for a missed period. Stress, hormonal imbalance, PCOS, thyroid issues, weight changes, or lifestyle shifts. Pregnancy is only one possibility. Myth number 3. Irregular periods are normal in all ages. Not always. Teenagers may have some irregularity initially, but persistent irregular cycles in adults should be evaluated. Myth number 4. Period problems are not serious. False. Your menstrual cycle is directly connected to your hormonal and reproductive health. Ignoring it for years can delay treatment of conditions that are easily manageable early. Now let's talk about something very important. When should you actually see a doctor? You should consider medical advice if your cycles are consistently irregular, your bleeding is very heavy or very light, your pain is severe or increasing, you miss multiple periods without clear reason, or you notice sudden changes in your pattern. Notice something important here. It is not about one single symptom. It is about patterns over time. Your body is not random. It follows a rhythm. And when that rhythm changes consistently, it is worth understanding why. Now let's talk about something most women don't hear often enough. Early action matters. The earlier you understand a change, the easier it is to manage. Many conditions related to hormones or reproductive health are highly manageable when detected early. But when ignored for years, they become more complicated. Now I want you to think about this carefully. How many times have you normalized symptoms just because they were common among others? Because common does not always mean healthy. And silence does not always mean safety. Now let's summarize this part. Heavy bleeding repeatedly is a red flag. Severe pain is not normal. Missing multiple periods needs attention. Persistent irregular cycles should not be ignored. Myths often delay diagnosis. Early consultation leads to better outcomes. And now we are almost at the final part of this journey. In the next section, we will talk about how to track your cycle properly, simple habits for hormonal balance, and how to take control of your menstrual health without fear. Because understanding your body is not about worry. It is about awareness and control. Now that you understand your cycle, let's talk about something equally important. What can you actually do with this knowledge? Because awareness is powerful, but action is what changes your health. Let's start with something very simple. Tracking your menstrual cycle. Many women rely on memory alone. But your memory is not a medical record. Small patterns are easy to miss when you are not tracking them. You can use a simple phone app, or even a basic calendar. Just note: start date of your period, end date, flow intensity, pain level, and any unusual symptoms. Over time, this creates a clear picture of your health, and patterns become visible. Now let's talk about lifestyle. Because your hormones respond strongly to how you live. First, sleep. Irregular sleep can disturb hormone balance. Your body needs consistent rest to regulate reproductive hormones properly. Second, stress management. Stress does not just affect your mind. It directly affects your cycle. Even simple daily stress, if constant, can influence your periods over time. Third, nutrition. Your body needs proper nutrients to maintain hormonal balance. Extreme dieting or skipping meals regularly can disturb your cycle. Fourth, physical activity. Moderate exercise supports hormonal health. But extreme overexercising without proper nutrition can also cause irregular periods. So balance is key. Not extremes. Now let's talk about something very important. Listening to your body. Most women are taught to ignore discomfort, to adjust, to manage. But your body is not something to ignore. It is something to understand. Every symptom has meaning. Not every symptom is dangerous. But every symptom is information. Now I want you to shift your mindset. Instead of asking, is this normal for others? Start asking, is this normal for my body? Because comparison often hides early warning signs. Now let's bring everything together. A healthy cycle is usually predictable most of the time, moderate in flow, manageable in pain, and consistent in pattern. But more important than perfection is stability. Your body does not need to be perfect. It needs to be understood. Now I want to leave you with something important. You are not supposed to suffer in silence. You are not supposed to normalize extreme pain. And you are not supposed to ignore your own health signals. Because your health is not a side topic in your life. It is the foundation of everything you do. Now let's summarize this final part. Tracking your cycle gives clarity. Sleep affects hormones. Stress impacts menstrual health. Nutrition and balance matter. Your body sends early signals. Awareness prevents long-term problems. And now, one final thought. If you take nothing else from this video, remember this. Your period is not just a monthly event. It is your body speaking to you. And when you learn to understand it, you are no longer confused. You are informed. You are aware. You are in control. If you found this helpful, follow her health decode. Because here, we don't create fear. We create understanding. And your body deserves that understanding.